The question is that this bill be agreed, the amendment be agreed to. I should say, call the member for Wright.
Thank you, Mr Speaker. This bill, the National Health Reform Amendment, National Health Performance Authority Bill 2011, proposes to establish a statutory authority known as the National Health Performance Authority. It introduces amendments to the National Health and Hospitals Network Bill 2010, only passed by the House on the 21st of March this year. The Health and Hospitals Network Bill establishes the Australian Commission on Safety and Quality in Healthcare and as an independent statutory authority. If enacted, this bill will amend the National Health and Hospitals Network Bill 2010 by changing its title to the National Health Reform Act 2011. Still to come, further legislation that will be established, which will establish a third statutory authority, the Independent Hospital Pricing Authority. When the initial bill was introduced last year, the Coalition called then for the government to provide all provisions to establish all of these bodies at the one time. But as usual with the government, what we have is a piecemeal approach of bill after bill and amendment after amendment. It's worth recounting the history of relating to this bill, this authority that it creates, and the warnings and the concerns that have been sounded loudly. It is an outstanding example of the ineptitude of this government. When the Minister introduced the initial bill, the National Health and Hospitals Bill, in September last year, as with virtually anything this government intended to do with health, it was described as historic and delivering on government's health reform agenda. Of course, the so-called reform agenda was somewhat different. Back then, these were the Roxon reforms, and as the Minister told the House, they were all about the hospitals networks that would be funded nationally and then run locally. At that time, the now Prime Minister Julia Gillard was still on board with Kevin Rudd's reforms, telling the Committee for Economic Development in November last year, from July 1, the Commonwealth's share of hospital funding will increase to 60%, GST retention and dedication to health care will commence. Like so much of this government's promises, that just did not happen, Mr Speaker. Julia Gillard earlier this year unceremoniously dumped the Rudd clawback of the GST and the commitment to the major funding of the public hospitals, and is now only going to provide around 40% of the public hospital funding. Yet, last year's election campaign, the Prime Minister also stated, and I quote, "I regard healthcare as one of the greatest responsibilities of any government. If my government is returned to office on August 21st, I will pursue our national reforms until the job is done." We all know what standing by commitments and promises to the Australian people are not high on this Prime Minister's list of achievements for her government. Her action in health is every bit as rigorous as the reversal of her promise that no government that she lead would introduce a carbon tax, a tax that Australian people do not want. Yet, one she steadfastly insists on inflicting on them by mid-next year. Mr Speaker, the National Health Performance Authority is to be charged with monitoring and reporting on the performance of local hospital networks, public and private hospitals, primary healthcare organisations and the bodies that provide healthcare services. It was to be an incredible wide-ranging brief. Unfortunately, the bill provides absolutely no performance indicators that the proposed authority would be monitored and reported upon. Now that just sounds hard to fathom, Mr Speaker, that a bill with such intense overtures has no performance indicators. The government-controlled Health and Ageing Committee held an inquiry into this bill, and there was one extremely brief public hearing for the Department of Health and Ageing to answer seemingly one question, and a report from the committee was then tabled with one recommendation, that being for the House to pass the bill with minor amendments requiring an annual report to the Parliament. Given submissions to the inquiry outlined serious reservations regarding this legislation, Coalition members presented a dissenting report that it would be unwise for the House to pass the legislation until stakeholders' concerns were addressed. The dissenting report noted that there are far too many unanswered questions about the National Health Performance Authority. The House should not debate this bill until the government clarifies matters. It also noted, and I quote, "A number of stakeholders that wanted to contribute to the inquiry were unable to due to the haste with which the inquiry was conducted." Now, this debate has been on the agenda, Mr Speaker, for many months, and to try and fathom that the reform process would have been rushed through is unthinkable. So it's worth looking at some of the detail of what the stakeholders said about this legislation. The explanatory memorandum to this legislation state that measures will have no regulatory impact on business or individuals. However, the AMA bluntly responded, "We do not believe that this is a true statement." The Australian Private Hospitals Association has concerns that this new authority will simply add, quote, "yet another layer of compliance burden for the public and private hospital sectors." Its submission to the House Committee inquiry stated that the national data collection must replace the current system of multiple reports to multiple government agencies, which says place a significant registry compliance burden on private hospital. The bill was also subject to a Senate inquiry. The Royal Australian College of General Practices warned the provision of this bill holding long-term threats, and I quote, "harm to the current high standards of medical services and consequent health services delivered to the community." Catholic Health Education held similar concerns in its submission to the Senate and stated the legislation is currently drafted is very broad, indeed vague, on the scope ranging from the detail of data that will be required to be submitted. I want to see that the details set out in the regulations that would enable the Parliament to exercise oversight. It said such that the detail was needed to avoid unintended consequences. I want to take you to some of the unintended consequences. It is warning where we look at a particular incident in the UK, where we need, for the example, to learn from the recent experiences of the Mid-Staffordshire NHS Trust in the United Kingdom, where it's been reported that between 400 and 1,200 excess deaths, together with appalling lapses of patient care and hygiene, occurred between 2005 and 2009 as a result of the local board and hospitals management focusing on meeting performance and cost-cutting targets than actual patient care. The College of General Practitioners pointed out that it was unclear whether general practices will be monitored by the authority, and that clarity is needed on this issue. Catholic Education also went on to say to echo many of the points, also calling for clarity on the role of the authority, noting that the Australian Commission for Safety and Quality in Healthcare and the Australian Institute of Health and Welfare for the Australian Bureau of Statistics already collected data on hospitals and health services. CHA also wanted the legislation drafted in such a way that the governance arrangements for the authority would reflect the make-up of the Australian health system and therefore have members with knowledge of the public and private hospitals, primary health care and private non-government health care provisions. The submission to the Senate inquiry from the Council of Prudential Specialists queried the very need for the authority and said no justification or compelling case as to why this is needed. Mr Speaker, there were recurring themes through many of the submissions to the House and the Senate committees, namely that there is a lack of clarity about the legislation and the authority it will establish, vagueness about what it will do, and the lack of goals and objectives concerned about duplication with other agencies and this government is establishing with existing agencies, worries about the administrative burdens being placed on health service providers and concerns about the composition of the authority boards. So predominantly, Mr Speaker, this bill tries to speak to the intent. Of giving power to the regions by having their own boards. However, the confronting reality is that the boards will neither have the power to make local decisions nor employ staff on a needs basis. This is just another expansion of Labor's centralisation overarching policies which will continue to haunt this political landscape. What this bill doesn't achieve is that it does not speak to the decisive action on waiting rooms. Yet it speaks to a predetermined goal of achieving 90% of patients being treated within 4 hours. And as I speak with my local practitioners who are already under duress, some suggest these goals are laughable under current conditions. This bill gives no guarantees to people on waiting list, either at my Bow Desert Hospital or the Gatton hospitals, as are they going to be treated any quicker. You see, introducing another layer of bureaucracy does not assist the frontline staff in meeting their day-to-day demands. These reforms are not patient-focused. It would not appear that the only focus of this government is to create a record amount of. It would appear that that this is the only focus of this government is to create a record number of bureaucrats in an already bloated public sector. Mr Speaker, what we're looking for is flexibility for the people on the ground to be able to make decisions that impact their workplace on a daily basis without having to deal with another layer of bureaucracy, without having to deal with a regional body that could be based hundreds of kilometres away, not having to play second fiddle to larger hospitals that will have their own priority list. Once more, regional Australia will be left out in the cold. As I've alluded to in my speech, many of the peak body groups are starting to lose confidence in this system. More changes at the top, increased bureaucracy and unanswered questions ultimately end up in producing fewer results on the ground, Mr Speaker.